Well, April is Autism Acceptance Month, a chance to raise awareness and celebrate differences.
For this week's Your Life, Your Health, medical specialist Emma Benson introduces us to a Utah family who has learned while life on the spectrum, it can be difficult, but it can also be beautiful.
Meet Liam, Ollie, and Milo.
Liam is 7, Ollie is 5, Milo is 3.
Brothers with different personalities that share a strong bond.
They have to put in the work to communicate, to be able to socialize. It's not something that they just intuitively get like other kids do.
Marjorie Grover started noticing autistic signs in 3 of her 5 kids when they were very young.
Liam was delayed in his speech. He was very shy to the point that he wouldn't really talk to anyone. Ollie came along and he was overtly physical and hyposensitive. With Milo, his emotional regulation was a big challenge. And he was also really sensitive to sounds and lights.
It impacts the child's ability to communicate, interact in social situations.
Tara Long is a pediatric nurse and director of care management at Intermountain Primary Children's Hospital. She says early intervention is key to treating autism.
The sooner the child can start in speech therapy or occupational therapy, the more successful that child is.
Symptoms and their intensity can vary from child to child.
There's a saying that goes around in the autism world, which is you've met one person with autism, that means you've met one person with autism.
Yeah, I like pink ones.
You like pink ones?
Through trial and error, Marjorie is finding what works for each of her sons.
We have to put in the work to help them be successful and be able to live in this world that is not created for people with autism.
Teaching them there's beauty in being different, and there's nothing they can't do.
They're needed in this world. I know that they're going to be okay.
I love you, Mom. I love you.
Emma Benson, KSL 5 News.
Love that laugh, Emma. Thank you. Utah Department of Health and Human Services has an early intervention program which provides free in-home therapies. Local school districts also provide developmental support.
Well, Primary Children's Hospital has a new space for patients with developmental disabilities. The sensory room was made possible by generous donors, and it gives kids the opportunity to play in a quiet, calm, comfortable environment away from the stress of the hospital. Various items and toys dot the room like bubble tubes, mirrors, balls, blocks, weighted blankets, color-changing floor tiles, and beanbag chairs. Sensory rooms like this one can have therapeutic benefits.
We've even at times had kids be able to go home sooner than they thought would be possible because we were able to see them in a space where they were comfortable and able to engage in a way that was more meaningful to them.
So if you have a child with autism or another developmental disability, you can ask a child life specialist if a sensory room is available during their hospital visit.